Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Blood sugar numbers can be confusing, especially when you feel like you're doing everything right and the results don't always make sense. In today's Q&A, I'm answering real questions about A1C changes, morning highs, CGM spikes, insulin use, and nerve symptoms, and clearing up what actually matters.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jedha.
Hello, wonderful people, and thanks for joining me for episode 117. Today's episode is a Q&A, and the questions you'll hear are ones I think many people will relate to. They highlight some of the most important areas of confusion around blood sugar, A1C, continuous glucose monitor readings, fasting levels, and diabetes complications. So my goal today is to help shed some light on these questions and bring clarity, context, and understanding to you. If you're one of our members and have questions, you can search our huge members library or bring your questions to the monthly member check-ins where you can get direct support from me and our expert nutrition team. For our listeners with questions, head to type2diabetestalk.com/message to send in your question. Okay, let's get into the first question. Deborah asked, I have lowered my A1C from 7.2 to 5.2, but when I eat, my sugars go up. I've almost given up rice, pasta, etc. What else can I do? Deborah, this is a really important point to clear up because it's something that people get confused about. It is completely normal for blood sugar to rise after eating. That rise doesn't mean something is going wrong. Every time we eat, glucose enters the bloodstream. Even in people without diabetes, blood sugar still goes up after meals. The difference is not the rise itself, it's how high it goes and how quickly it comes back down. Your A1C of 5.2 tells us your overall blood sugar exposure is now low. That means, on average, your body is handling glucose well. Seeing a rise after meals doesn't cancel that out. It is perfectly normal for blood sugar to rise after meals and fluctuate daily. It's never going to be one constant number. That's not the way blood sugar works. What we don't want is blood sugar staying high for hours or climbing higher and higher across the day. So a temporary rise after a meal, followed by a return toward baseline, is normal. That's how the body works. So I hope that clears that up. And the key message here is that post-meal rises are expected. Persistent elevation is the problem, not the rise itself. Of course, you still want to be keeping those post-meal levels in the ideal range, making sure they're under 140 or 7.8 2 hours after meals. But if you've lowered your A1C from 7.2 to 5.2, this is absolutely fantastic, and you've already demonstrated that your blood sugar is coming back down effectively. So whatever you're doing, keep on doing, because that is working for you. Tom said, I do a pretty good job of controlling my postprandial numbers, but I can't budge my morning fasting numbers. My average numbers in the morning are 150 plus. I always have a spike in the morning. My last A1C was 7.1. I take only metformin. I feel that if I could solve the morning problem, I could get that down. So Tom, what you're describing is a classic morning fasting rise, often called the dawn phenomenon. In the early hours of the morning, hormones like cortisol and glucagon rise to help the body wake up. In someone without diabetes, insulin automatically rises to keep glucose stable. But in type 2 diabetes, that insulin response, it's blunted due to insulin resistance. So the liver releases glucose and blood sugar climbs higher before you've even eaten. Fasting glucose, it can have an influence on A1C, especially if they're high on a regular basis. And if your mornings start high every day, it keeps that average elevated, even if meals are well controlled. But your A1C is at 7.1% and you're taking metformin, so that's still quite a high A1C. And A1C reflects 24-hour glucose exposure over an average of about 3 months. And it is rarer that fasting glucose alone would explain an A1C of 7.1 if post-meal glucose were to truly stay in range all day. So it could point to persistent insulin resistance, certainly liver insulin resistance and liver glucose output. There could be some post-meal glucose elevations that you're not picking up on. But let's just say that if we focus on the morning numbers, well, fasting numbers improve when overall insulin resistance improves, particularly that liver insulin resistance, and when your overall metabolism improves as well. And that means looking at things like total daily carbohydrate load, nutrition and food quality, evening eating patterns and late night snacks, sleep quality and stress both strongly affect morning glucose, exercise timing, supplements, and in some cases, timing or dose of metformin. There's actually a lot you can do, and we've covered some morning blood sugar info in episode 38, so I'd recommend listening to that for some great tips. And if you're one of our members listening, you can find a detailed health map that walks you through the most effective strategies to lower fasting levels. So just head into the membership site to find that, because there are some fantastic strategies that will walk you through step by step on troubleshooting your fasting levels. Next up, something from Elliot, who said, A1C versus blood sugar. I couldn't understand what you were saying. It was very unclear. Sorry. What Elliot is referring to is episode 74, where I covered the difference between A1C and blood sugar. So firstly, don't be sorry, Elliot. The episode did cover things quite clearly, but it can take some time to wrap your head around these things, especially when you're newly diagnosed. So blood sugar and A1C, these both measure the same thing, but in a different way. Blood sugar, also known as blood glucose, is the amount of glucose circulating in your bloodstream at a given moment. And this is tested with a finger prick monitor or a continuous glucose monitor, and it tests your day-to-day blood sugar levels. A1C, also referred to as hemoglobin A1C, HbA1c, or glycated hemoglobin, is a blood test that provides an average of your blood sugar levels over the past 3 months. This test is one that's usually ordered by your medical doctor and tested via a blood draw at the pathology. A1C can't measure day-to-day levels in real time, but it measures the average glucose on your blood over 3 months. That's the key difference. So both tests are related to blood sugar, blood glucose, and both tests are helpful. But because you do blood sugar monitoring on a daily basis, it provides immediate feedback on how your nutrition and lifestyle are affecting your body so you can adjust things in real time. A1C gives you an assessment of your overall blood sugar control over a period of time. So essentially, if your daily blood sugar levels are within range, your A1C will be within range as well. Of course, there are other factors that can affect blood sugar, but in general, that is the case. If your daily blood sugar levels are within range, your A1C will be within range as well. So I'd recommend, Elliot, you'd go back and listen to episode 74 again, as it is explained in that podcast in detail, the difference between blood sugar and A1C, but perhaps this simpler explanation will also help you get your head around it. And when you go back and listen, it might help reframe how you think about it as well.
Don't spend months or years trying to work out how to treat your diabetes. With Dr. Jedha's VIP online membership, You'll have trusted support wherever you are at your fingertips whenever you need it. Access detailed guides to understand exactly what to eat. Explore the huge members library. Receive delicious weekly meal plans and join monthly member check-ins for personal feedback and accountability. Learn more and join as a VIP member today. Visit type2diabetestalk.com/programs.
Judith said, "Okay, in December 2024, my hemoglobin was 5.5, and then in April, when it was checked, it was 5.9. I then started eliminating high carbs, sugar, and anything else that could affect it. My exercise level has always been high. I do 10,000 steps a day, and I do a lot of physical activity. In July 2025, the hemoglobin was back down to 5.5, continuing with exactly the same routine. Then I had it checked in November, and it was back up to 5.9, and nobody can tell me why. Can you?" Judith, this is actually a really common pattern. So we've seen there's been some fluctuation in the A1C levels over a period of about 2 years. It's gone down, it's gone up a little bit, it's gone down, it's gone up a little bit. And that 0.4% isn't a huge rise in A1C. Now, an A1C moving between that 5.5 and 5.9 can happen even when routines don't change. A1C isn't a fixed score. It's an average that can shift with relatively small changes over a few weeks because it measures the average over a few months, remember? So things like stress, poor sleep, illness, pain, inflammation, or even a busy or disrupted period of life can push average blood sugar up even slightly without any obvious dietary changes. Seasonal changes can also play a role. Many people see higher readings later in the year. And another piece people aren't told about is that A1C isn't only influenced by glucose. We can see changes in A1C when there's issues with iron levels, B12, or how long red blood cells circulate. That can move A1C up or down without a true change in day-to-day blood sugar. So the key takeaway is this: your body clearly responds well and your A1C management looks good overall. And these small rises don't cancel out the work you're doing. It might indicate you need a slight change in routine on some level, and if anything, it's a sign to look beyond carbs and steps and consider the bigger picture. Look at sleep, stress, recovery, and trends over time, not one result in isolation, because those things may be contributing and one result in isolation isn't always the most important factor either. Geeta said, "I am diabetic type 2 on insulin and struggling to keep sugar levels down." I'm sorry to hear this, Geeta, and you're certainly not alone. This is something we see a lot. And one of the challenges with insulin is that while it lowers blood sugar in the short term, it doesn't fix the underlying issue. In many people with type 2 diabetes, insulin resistance is already high, and adding more insulin often makes that resistance worse over time. And that can make blood sugar harder, not easier, to control. This often leads to a frustrating cycle. Blood sugar rises, insulin is increased in terms of dosages, numbers improve briefly, then creep back up again. It can feel like you're constantly chasing your levels. The good news is that insulin doesn't mean you're stuck. Blood sugar still responds very strongly to food choices, total carbohydrate intake, meal timing, physical activity, and weight changes, even when insulin is being used. So many people are able to lower their insulin dosages over time by addressing those factors and improving how their body responds to insulin. Even if you're taking insulin, many people can work toward getting off it or at least reducing dosages, which is ideal because that is really going to help you keep your sugar levels down as well. If you're struggling, despite being on insulin, it usually means the focus needs to shift away from simply adding more insulin and toward reducing insulin resistance and improving metabolism overall. And we just talked about the ways to do that are through nutrition and physical activity. And this is something we work through step by step with our members. It can take some focused effort, but there is certainly always a way to improve those numbers. Dale said, I heard venison was not good for a diabetic. Is this true? The very short and simple answer is no, that is not true at all. Venison is actually a very lean source of protein, and on its own, it has virtually no impact on blood sugar, or very little to say the least. Protein, it really doesn't raise blood glucose in the way the carbohydrates do. So from a blood sugar point of view, venison is not a problem. And in fact, there's nothing about venison itself that makes it bad for diabetes. It is a nutrient-rich, healthy food. So if you enjoy venison, go ahead and eat it. Eileen asked, what is the best device to monitor my daily blood sugar levels? So Eileen, there are two main ways people with diabetes monitor their daily blood sugar. Traditional finger prick glucose monitoring is the first way, and this is where most people go to first. It's where you use a small lancet to prick your finger and you get a small drop of blood on a test strip, and the meter gives you a number, your blood glucose number. It tells you what your glucose levels is right then, before a meal, after a meal, or any time you choose to test it. It's a simple test, pretty reliable and great for checking specific points in the day. Then there's a continuous glucose monitor, or CGM. And a CGM is a small sensor you wear on your skin that checks glucose levels every few minutes. It shows you trends, how your sugar is changing over the day and night, without repeated finger pricks. You can see how food, activity, stress, and sleep affect your numbers in real time. Both tools have value. Finger prick meters give you data points when you need them, and you can log those numbers to see trends over time. CGMs give you a broader picture of patterns and trends with automatic measurement over time. So both types of testing can achieve the same outcome. It's just that people find CGMs more convenient, and some people find them especially useful for understanding how different meals or activities impact their glucose. But you can, like I said, use those finger prick testing to do the same and keep a log. Finger prick testing is generally cheaper than CGM monitoring, but either option can help you keep your daily sugar levels under better control, and that's the whole purpose of any device that you choose. In terms of best brand of device, we won't go into that, but there are many different choices to choose. But there's that traditional finger prick glucose monitor or the continuous glucose monitor. Both beneficial. It just really depends on your budget and also what you prefer to use. So before we go on to our next question, let's hear a testimonial from one of our members.
Pat said, "Your resources provided the tools I needed to bring my blood glucose level down until my A1C test results were within normal range. Thank you for all you do."
Son asked, my CGM shows 1 hour after eating. My blood glucose is often over 8 millimoles if I eat carbohydrates, but by 2 hours it drops under 7.8. Am I pre-diabetic? This is a really good question. And the short answer is, if your levels are normal at 2 hours post, you wouldn't be diagnosed with pre-diabetes. So here's the thing, it's completely normal for blood sugar to rise after eating carbohydrates. Even in people without pre-diabetes or diabetes, the 1 hour glucose, it can rise and sometimes go over that 8 millimoles, which is 144 milligrams per decilitre. That early rise on its own doesn't officially diagnose anything. If your blood sugar is coming back down by the 2 hour mark and it's under 7.8 or 140, that tells us your body is clearing glucose effectively and efficiently, and that's a good sign. Prediabetes isn't diagnosed based on a single post-meal spike. It's diagnosed using fasting glucose, A1C, or an oral glucose tolerance test, not CGM readings alone. But in episode 114, we did cover the potential importance of a 1-hour post-pill blood glucose test. According to research, if levels are frequently above 8.6 millimoles or 155 milligrams per decilitre at that 1-hour mark, it could suggest higher risk of prediabetes and issues with metabolism, even if fasting glucose and A1C look great. It still doesn't diagnose anything, but it could be worthwhile to pay more focused attention to your eating plan and lifestyle to ensure no issues develop down the track. And listen to episode 114 for more info about this. But for now, I wouldn't worry over anything because it appears like your blood glucose is doing exactly what it's meant to be doing and staying within range after that postprandial meal. But for now, I wouldn't worry about anything because it sounds like your blood glucose is doing exactly what it is meant to and clearing glucose effectively and efficiently. But like I said, listen to episode 114 for more info about that 1-hour glucose test. Jim said, I'm starting to get toe nerve pain. It's mainly when I lay in bed and I have to get up. Is this a diabetes complication, and why does this happen when I lie down? Jim, toe or foot nerve pain can be related to diabetes, but it's important not to jump straight to worst case conclusions because nerve pain linked to diabetes often shows up as tingling, burning, pins and needles, or sharp discomfort in the toes or feet. It can be more noticeable at night or when you lie down, partly because there are fewer distractions and you're more aware of those sensations. And changes in circulation and how nerves fire at rest can also make symptoms feel stronger when you're in bed. That said, not all toe or foot pain is diabetic nerve damage. Things like pressure on nerves, foot wear, back or spinal issues, circulation changes, vitamin deficiencies, or even foot structure can cause similar symptoms. So what matters most is blood sugar exposure over time. This is what causes diabetes complications. So nerve irritation tends to develop when glucose levels have been running high for prolonged periods of time. If blood sugar improves, especially early enough, nerve symptoms can stabilise and they improve or even disappear. We commonly see this with our members. So the answer is yes, it can be diabetes related, but it's not something to self-diagnose. New or changing nerve symptoms are always worth discussing with your medical doctor or seeing a podiatrist so they can rule out other causes, and also they can use special tests to check things like circulation, sensation, and you might want to get your nutrient status checked as well, particularly for vitamin B12. So the earlier this is looked at, the more options there are to slow or prevent progression if it is diabetes neuropathy. And if it does turn out to be neuropathy, I covered natural treatment in episode 35. That's all for today. I hope today's Q&A helped clear up some of the confusion and frustration that can come with blood sugar numbers. The big takeaway is this: trends matter more than single readings, and there is almost always a logical explanation even when it doesn't seem obvious at first. And there is certainly always a way to improve those numbers as well. If you have a question, head to type2diabetestalk.com/message to submit it. If you found this episode helpful, please share it with someone who might need it. And don't forget to subscribe so you don't miss future episodes. Thanks for listening, and I'll see you in the next episode. Dr. Jedha, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.